want to go through some case studies now, because I think we learn a lot when we go through case studies, when we see some real live information. This person was a patient in our primary care practice who had a family history of heart disease. Anybody read the book? I know some of you have. Yeah. I wrote about this person in the book. Very strong family history of heart disease, both parents, by the way. Diabetes, both parents, and father had colon cancer. And his dad actually died at 21 years old. And so he was really kind of devastated by that and said, I don't want those diseases, and I don't want to die the way my dad died. So he's very motivated to live the life that will prevent disease. He was a runner, or he is a runner, low-fat diet, and he had a screening cholesterol test with a cholesterol of 140. Now, if anybody knows about cholesterol, that's a very low, right? But he had a heart scan that was positive. And he was doing this, literally, since he was a very young man. Next slide. This is his personality. I'm learning how to relax, doctor, but I want to relax better, faster. I want to be on the cutting edge of relaxation. So he was a man who's like, I don't want this disease, and I want to be on the cutting edge of, and I'm going to ask my doctor. So he's got a pretty hip doctor, and he would go in and he said, you know, okay, give me 3 days of MRIs. I want to make sure I don't have cancer. And he says, are you sure? And he goes, yes, just give me the drugs. I'll go in, I'll do 3 days. Nobody wants to be in an MRI for 3 days. Anyway, he had a little bit of shoulder problem, a little bit of knee problem. He goes back. He said, you're really healthy. Look at your cholesterol. You're healthy. You don't have anything. Anything you can tell me that will, tell me that I don't have heart disease? Yes, go get a heart scan. So he went and he got a heart scan and he came back positive. Next slide. So this is what we found on the heart scan. We were actually able to slice through a fast, what we call EVT heart scan, and we were picking up white spots. And that was the plaque that you can see in here. And we were able to measure it. And this was wrong. Something was wrong here. And I was actually very, very interested in this person, health history. Next slide, see if we can go to the next. This is what we were actually picking up. If you slice through an artery, this is actually what you can see. You can see the plaque that juts out into the artery. And if it juts out far enough, you can actually block and close off the actual artery. Now, if it's going to the brain, you can have a stroke. And if it's going to the heart, you have a heart attack. And if you're lucky, you go to the emergency room and you get a stent and a little surgery or a bypass. But some people don't make it. Next slide. So I was interested and said, a cholesterol of 140 and heart disease, this does not make sense. Why is this? And so I did a little research, and what I found was Dr. Sapirko's work and Dr. Goffman's work. Dr. Goffman was a research doctor at UCSF. He actually was the doctor who wrote that paper about there is no level of radiation that's good for a human body or for a human cell. He also found out that we actually have 13 different types of cholesterol, not just 2 groups. And this was really interesting to me. I think I was away that day too. But what I found is actually there's 7 different types of bad cholesterol and 5 different types of good cholesterol. And this was very interesting to me. I mean, it's just, why is nobody hearing about this information? Next slide. So what we found with him is that he had a lot of these smaller particles, a lot of these small LDL particles that were slipping below the lining of his artery. They were coming out of his liver, and they were circulating around his body in his coronary arteries, and they were causing inflammation and oxidation, so the artery was bulging out, and we were able to measure it. And so we took a look at his ApoE. He had a very normal 3.3 ApoE. Next slide. I'm going to come back to this one. And just a second, did you notice when he was in the plane how his face was very fat? Look at his face now. So what we did is we did this advanced cholesterol. We found this. We put him on a high-fat diet. all of his small dense LDL got turned off, and the bigger ones started coming out of his artery. They kind of bounce off and go back to the liver. They don't slip below the lining and cause oxidation and inflammation. Well, why was this? Well, what did he do? What was he doing? He was doing behavior of low-fat diet, exercise, a lot of exercise, and he was trying to do the behavior that the Heart Association was telling him, the Pritikin was telling him, the Dean Ornish was telling him, and it was actually making him very sick. He had an insulin level that was very high. He had a glucose level over 100. He was pre-diabetic, insulin resistant. He had heart disease, and he had this small dense LDL turned on at very high levels. He also had a very low ability to clean his artery, and this was causing him to actually slowly die, and was causing an imbalance in his body. So we put him on this higher fat diet. How interesting is that? And everything normalized. Look what happened to his body. Now, he was already an exerciser, and so he lost a bunch of weight and all of his chemistries normalized. And he's actually had a heart scan since. It is a tad bit better. It's not, not all the way gone, but it is definitely better. But it takes a long time for the artery to clean itself, because of course we're not always perfect, right? I have a little confession, as this is my husband. But this is the reason why I'm doing the work I'm doing. I was able to notice that something was going on that was wrong with him. I had the opportunity to be involved because his doctor is actually a colleague of mine, and I worked in the primary care practice. So I noticed this, and what happened is, and I don't know if you remember this, Robert, we all went and got a heart scan, actually, because I have family history of heart disease. J.B. Humphrey said, take Pam with you. And I think I dragged Robert along also. And my heart scan was negative, and his was positive. When we jumped in the car and went home, he disappeared. He was sitting on the bed, crying. And I had very rarely seen my husband cry, only when our children were born. But, he says, am I going to die? I said, absolutely no way. But as a medical provider, I said, I will find the answer. And as a wife, I said I would find the answer. But I had an opportunity. I couldn't save my grandfather at 8, but I could save my husband. But now I'm saving a bunch of people who have a heart disease mystery or a chronic illness mystery, but now we can fix it. And we can use integrative medicine and a gentle solution of diet to cure a very, very horrible disease.